Medication Errors Among the Elderly in Our Society by Alison Roganis. In the spring of 2017, my dad was rushed to the emergency room. He was not responsive and his breathing was faint. He was suffering from a major heart attack and loss of blood and oxygen to his major organs due to internal bleeding. The doctors weren't sure he would survive the week. By the grace of God, he is still with us today. Upon discharge from the hospital, he was provided with several new medications and 3 specialty care providers to follow up with. At that time, I became the primary caretaker and the person responsible for his medication list. Through this process, I have become aware of the importance of how his daily medication routine is keeping him stable, as he's constantly in a fragile state as his heart function is 10%. Managing his medication is an extremely detailed chore. I am happy I can help my dad with his medication to guarantee he is taking everything correctly. I have learned communication with all providers is vital to prevent medication mistakes and to ensure all providers are well coordinated. Unfortunately, technology has not advanced sufficiently. All providers do not share the same computer system. I have learned that this has placed additional pressures on those who are ill or need to take medication. Each medication list needs to be updated every time there is a change, and this includes hospital visits as well. Medications errors cause harm to patients and unnecessary hospital visits. Many admissions are due to seniors taking medications erroneously. I've often questioned how the elderly population does this on their own. Nearly all Americans over the age of 65 take at least 1 medication. Not all will need help administering their medicine, however, this is an extreme high number. Our younger generation may not realize how simple tasks become difficult for our older elders. Removing a medication wrapper, a pill box setup may be a struggle, along with reading or hearing instructions can be quite difficult. Our medical society is placing too much stress on our elderly patients by neglecting the fact that they may not have the necessary abilities to maintain their proper medication regimen. The elderly population faces many problems with the medication administered to them by healthcare providers today. Communication barriers between provider and patient can cause a detrimental situation and cause other illnesses, adding to their already long list of ailments. Providers may not be able to explain the diagnosis and to take the prescribed medication down to a grade level where the patient can comprehend how to administer properly at home or understand how serious of a problem they may have. The patient may have a language barrier and may be embarrassed to ask for a translator. Inappropriate drugs may be prescribed, causing additional complications to the elderly patients, which will cause significant harm. An additional obstacle to consider is when the patient uses the same pharmacy. Many of the pill bottles may be similar in size and color. The instructions on the pill container may be too small to read without the help of a loved one or a magnifying glass. Additional challenges that elderly patients face when managing their medications, including relatively high rates of preventative adverse drug events, failure to appropriately prescribe and monitor indicated medications, and frequent use of drugs considered inappropriate for elderly patients. These challenges can have lethal effects if they are not addressed by healthcare providers and their patients. A family member or advocate can question the provider, asking if a medication is safe for their loved one to take. It is very important to understand these issues to help aid patients and obtain better patient care. Overprescribing is very dangerous. It will and can cause more health issues managing multiple diseases and treatments. Medication management is increasing in complexity because of its growing evidence for multi-drug regimens and chronic diseases. Polypharmacy is often unavoidable. Many elders have several care providers coordinating their care depending on their health. Managing inaccurate medications become more problematic. The medical community defines a person taking multiple drug prescriptions as polypharmacy. When polypharmacy occurs, many more medication risks can arise. Many medications work effectively when they are taken on a routine schedule. Planning and scheduling medication by accounting for all the pills in a medication box keeps the medicines organized according to the correct time of day to take. It is ever so important for all doctors to have a complete list of medication with the dose prescribed and quantity per day. If the provider changes anything on the medication list, it is important for all healthcare providers to know. Healthcare costs are on the rise. The elderly patients are faced with high deductible coinsurances and higher prescription costs. These expenses can especially be stressful for the seniors on a fixed income. Adding one additional medication monthly cost can really impact their budget and health. Insurance coverage is so difficult to understand, let alone comprehend all the separate prescription coverage. Trying to find out what is covered under the specific pharmacy plan is very difficult. It seems a special college degree is needed to understand all of its intricacies. The cost and misunderstanding of coverage may lead to noncompliance or not taking the medication as prescribed. Either could lead to a bigger health issue. It is so important for the elders to have a comfortable relationship with their providers, so if any issue of medication costs arose, other options may be pursued or financial assistance may be available. Physicians also need to have an open line of communication with their patients on the importance of taking the medication. This was highlighted by Wilson. Timely and focused physician-patient communication will be required to address these costs and quality challenges. The cost of prescriptions cause additional stresses on our already ill patients. What can you do to help an elder in your family to keep them from medication harm? How can we prepare ourselves if we suddenly fall into a situation like I did with my dad? First and foremost, if there's someone who can be involved in assisting in the care of the elderly, that is of the utmost extreme importance. If there's not a family member to assist, perhaps a cognitive exam could be administered by a provider to see if the patient is able to take and sort their medications without assistance. If the patients are deemed to be incapable, assist the patient, find a program to help them with the dispensing of their medication properly. Prescription and drug administration is a problem in our healthcare system today, especially with our aging population. Keeping a proper medication regimen is very difficult for our older adults. With proper awareness, screening, and help aided to these individuals, we can increase patient safety and decrease costs in hospitalization and pharmaceutical expenses.